I'm Lloyd Holiday, and this is the Cost of a Thing podcast. Thanks for listening in today. The cost of a thing is the amount of time that you must spend working to buy the things that you want and need. And that directly determines your standard of living. This is podcast number 4, and today we're going to talk about another one of the top 10 super ripoffs that's ripping off our economy in the United States today and lowering our standard of living. And housing was the number 1 ripoff in the top 10 ripoff list. And this one is number 2 in the top 10 list. And it's a huge ripoff, the medical ripoff. And as with any ripoff, the definition of a ripoff is usually somebody is getting a lot of money for doing very little or even nothing. No product, no effort, but they still get a lot of money. And that is how these, usually the background behind these ripoffs. And another thing that defines a ripoff is it's usually something we absolutely have to have. We need this. And the people that are pulling off the ripoff, they know this. They know you have to come to them. And that's how it all works. And still another characteristic of these super ripoffs is that I've noticed is that the government and the media, they seem to work together to try to just make people think that this is the way it is. And it's just the way it is, and you got to accept it. There's going to be expensive houses, and there's going to be expensive medical. And it's not really questioned in the media. It's not really questioned by government. Just the way it is. That's another one of the characteristics of it all, of a ripoff. And of course, the giant super medical ripoff fits right in to that description perfectly. And of course, it's not surprising that medical would be in the top 10 economic ripoffs in the United States. Probably most of us know about the high prices and the little value that is gotten from medical services these days. You know, we all know about the expensive doctor visits, the expensive procedures, the expensive pharmaceutical drugs, the expensive insurance, unbelievably expensive insurance, the expensive testing, on and on. Everybody knows about it. And the expensive hospital stays. Unbelievably. I can't even imagine what they are now for a night in the hospital. I'm going to look that up in future and present it in future podcasts. And it goes on and on. The expensive medical schools. Several $100,000 in medical school loans for a doctor to get a medical degree, medical license. You know, add it all up, and this is a monster. This is a monster super ripoff. A very good description that I heard of a hospital today. It was described as a cathedral of sickness. There's these massive, beautiful buildings gotten from all the big money that rolls into those places. And they're beautiful. Cathedrals of sickness. That's a great description. And then, after all of the uncomfortable procedures, the drugs and their side effects and the misery from them that they give you. And the rest of it, staying in the hospital and all these things. The best that the medical establishment, the medical industry can do for you is get you back to square one, to get you back to health. That's it. That's the best they can do. You know, there's no real product here that they're producing. Again, it's another one of these things where it sucks a lot of money in, and there's no real product that comes from it, other than you might get well. And most of the time, you don't get well anyway. You're on some subsistence medication, or you're under a constant doctor's care, and you never get off of that. So let's look at this medical ripoff. Let's analyze it a little bit. And whenever I start to analyze something to see if it's too expensive or to compare it, I like to have a frame of reference. And I did that the last one on the housing ripoff I compared it to the price of housing in the 1960s as compared to income. Well, similar thing I'm going to do here. I'm going to look at the cost of medical care in the 1960s versus today. And I'm going to take a look at that right here. And I'm just going to take a quick look at it. I'm not going to go into it in detail. I'll do that in future podcasts. But as I looked into it, and anybody can type this in and find this out quickly, the percentage of the GDP that was spent on medical care in the United States in the 1960s was about 4 to 5% of the GDP. And the GDP just means all the money spent on everything in the country. About 5% of those dollars went to medical care back then. Today, it's 20%. In 2018, it was very close to 20%. I think 19.7%. So 1 out of every $5 that's spent in the United States today is spent on medical care. So you can see that's 4 times more. And then this GDP has expanded so much, and that's 4 times more was spent just using that comparison as was spent in the 1960s. That's why we're feeling this ripoff so badly. And if you want to just look at it in pure dollars spent, in the 1960s, averages to about $50 billion a year was spent, total amount of money spent on medical expenses in the United States, $50 billion. Okay, in 2018, $3,500 billion was spent. That's $3,500 billion, which is $3.5 trillion. Excuse me there, I'm so astonished by these massive amounts of money, these figures. They hardly will come out of my mouth. But 50 billion in the 60s spent total on medical expenses per year. Now 2018, 3,500 billion. Okay, that's 70 times more money is spent today than was spent 50 years ago on medical expenses. And that during a time when the population maybe grew by 40, 45%, something like that. This went not even doubled. Population certainly did not double since the 1960s, but the medical spending not only doubled, it went up 70 times. So there's some evidence of the massive ripoff right there. And this huge 70 times increase in spending on medical since the 1960s cannot be accounted for by inflation. the average annual income of a worker has gone up 5 to 7 times since the 1960s. So it's not accounted for by inflation. And you can also look at the percentage of the GDP that's spent as another indicator of the complete ripoff that it is. And if you just look at dollars spent on medical expenses per person in various countries, in the United States we spend a little over $10,000 per person every year, whereas most of the other developed countries that have, many of them have government health plans or programs that cover everybody, and they spend, most of those spend about $4,000 or $5,000 per year per person. So we're spending more than double what they're spending per person, and we're not covering everybody. I think I read the other day that there's still 26 million people in the United States without any health insurance, even though, this whole Obamacare thing was supposed to cover everybody. So there it is. We're spending double what the other countries are spending. We're not covering everybody, and the outcomes aren't that great. We have our USA life expectancy per person is about 79 years old, and that's about 53rd out of the top 100 countries. So for all that spending, we're not doing so good. Yes, you have all of these uncomfortable and barbaric, sometimes barbaric procedures. You have these drugs with these many times horrific side effects that actually are worse than the actual disease the person came in with. And all of these uncomfortable tests with, the CT scans with hundreds of chest x-rays worth of radiation. And on the blood testing and all these other tests, and of course then there's the false positives, so then you have to go in for further procedures and more invasive tests to rule out that there could be something there. And then you have the medical deaths caused by the medical industry, and I don't know how good these estimates are, but there's estimates that is the third leading cause of death in the United States. I've seen many surveys like that. Over somewhere between 200,000 to 300,000 people are killed every year by medical mistakes and other medical results from going to the doctor or hospital. And that's one I'm going to be looking into very closely to see if that's really true or not. But it seems to be, from what I'm seeing. And I've seen studies where it's estimated that 70 to 80% of all the medical problems and diseases and things people get and expenses that are incurred are really unnecessary. That if people just ate a better diet and did some exercise and avoided smoking and some of the other heavy drinking and illicit drugs and some of the other things, that they wouldn't even have any of these problems in the first place. And I think there's something to all that. Now let's talk about who benefits from the medical ripoff. And of course, we probably all know who's benefiting. We've got of course, the doctors are very highly paid many times. I don't think all of them are, but many of them are making millions of dollars a year. And then you have the hospitals. They're making a lot of money. Many of those are privately owned. like corporations. You have the whole pharmaceutical industry. That's the pharmaceutical industry that just is raking in the dough on this stuff. Of course, Wall Street benefits because they buy the stocks and deal in the stocks in these different companies and so forth. The insurance companies are making huge amounts of money on this. You have the medical schools, the nursing homes, the CEOs and the executives in all these companies making huge amounts of money. And so those are some of the people benefiting, and we're going to get into all that in future videos a lot deeper. I'm just brushing on it today. Well, I'm going to go into it a little deeper about how much each of these groups gets of the $3,500 billion, the $3.5 trillion spent every year, which is $3,500 billion. Okay, hospitals get the most. They get 1/3 of that. So they get over $1 trillion. The hospitals, they take the biggest cut out of that $3,500 billion pie, 1/3 of it. And you got doctors, they take another 16% goes to them. So if you add up hospitals and doctors, they're getting half the money. Then you add in the pharmaceutical companies and the drug companies and all that, they get another 12%. So right there, you can see where the money's going. Hospitals get 1/3, doctors get 16%, and drug companies get another 12%. That's 2/3 of the whole pie goes to those three people. And then there's other administration costs and insurance administration costs and so forth that are much more minor. Smaller amounts take that other third. But that's where most of the money is going, to the doctors, to the hospitals, and to the pharmaceutical companies. And as with most of these ripoffs, whenever you have super expensive prices like this, usually the government is involved in there somehow. They get in there with their regulations, and that drives things up, and it mutes competition so that it's not a true competitive business environment in the medical industry. And then all these people are on Social Security, Medicare, and the old people over 65 are on Medicare. Then you have the whole disability group that's also on Medicare, and you have Medicaid for the poor. And that's probably makes up, I'll look into it, but it looks like it's about 1/3 of the population of the United States gets free medical care from the government. And then that sets the floor for pricing. And again, it kicks up the demand also. So the government's in there pushing the demand up again by giving a lot of people free money to spend on medical. And of course, the government is also involved through the legislative process because they can be lobbied by these very powerful and very wealthy groups that get all the money from the medical industry, or most of the money, and they're all lobbying the government for favorable laws that will keep that money rolling in into the future. So you have a lot of people getting very, very rich on the medical system, the medical industry. And you might say, in another way, that there's a lot of people who got rich and who are getting very rich off of sick people. Okay, I'm going to wrap up podcast number 4 on the super medical ripoff. And I suppose a person could keep going and do 3 or 4 university level courses on all of this and still maybe not cover everything. And this podcast is just supposed to be an overview, and I'm not going to get into too much detail. And I will be doing that in future videos. I'll get into all of these aspects of the medical ripoff and the other ripoffs in much more detail. Thank you for listening in today. And until next time, this is Lloyd Holiday signing off.